Hello everyone! Today we are doing a lifting thread procedure on this beautiful patient. This is our first time getting lifting threads. So here we are just starting off with a little bit of lidocaine with epi right at our insertion site. I like to use lidocaine with epi just to kind of help constrict those vessels and help a little bit with bleeding. She unfortunately did bleed a little bit still anyways, which is, normal, but it does help out and make your procedure a little bit more clean. But here I am just going in with an 18 gauge needle to make my pilot hole. And I kind of move my needle back and forth just a little bit. I'm not like tearing through the tissue, but I'm just trying to open up that initial point so we are able to just get in a lot easier when we go in with our cannula and with our threads. So here I have my cannula and I also have 2% lidocaine drawn up in my syringe, and we are just going to make our way down our track. You want to make sure that you're in the correct plane even when you're just doing your anesthesia, because this is going to make it a lot easier to go in with your thread and just be in the correct plane right off the bat. It makes it a lot more comfortable for the patient if we're not going, in and out. So here I am just going down through my first vector down to her nasolabial fold, and I always let my patient know that this is pretty much the most uncomfortable part of this procedure just because the lidocaine does burn a little bit. But here I'm going down to my marionette vector, and we did choose to do all three vectors for her today as well as a jawline. We also went down and did a thread in her neck as well. But if you're in that correct plane, it's a pretty smooth getting that cannula down to the end. And I just do the same exact thing in every single vector. So here we are going down to our jowl. I also have my antigonal notch marked off there with a little X. Very important, especially if you're using the sharp threads, just because we don't want to, hit that facial artery at all. They will get a very big hematoma. So we just want to avoid that. So I just mark it off, and I always check where it is when the patient's laying down as well. Just to ensure it didn't move, like my marking didn't move at all. Now we are going in with our first thread, and I am just going all the way down past that deficit. You either want to be past the deficit or before it. Otherwise, we might risk seeing that thread while the patient animates. And as you can see, that was a pretty smooth placement. We, already made that correct plane with our 18 gauge needle and our cannula. So it's just about following along that path and getting it all the way down to the end and past that area of animation. So here we are going in with our second thread. Something to keep in mind is you can't back up once you have this thread engaged. As you can see, it's kind of hanging out at the end there. And if we were to pull back, it's going to start engaging, and that thread is going to be stuck there. So we always want to make sure that we're not pulling back. If you do want to pull back, you can do a little trick and put a 3cc syringe on the end and kind of capture the end of that thread so it can't engage, just so you can kind of move it back and forth in case you get into the wrong plane there. But I just do a light pull, and there we go. I'm going to clean her up. I like to alcohol over my point there just before I put on a Band-Aid. And as you can see, that little blanching right there at the entry point is just from our lidocaine with epi, nothing to be concerned about. And there I just went over with my thumbs. The barbs are bidirectional, so I just wanted to make sure they were, all popped into place. Sometimes the patient will have what we like to call zingers, which is just where some of those barbs engage over the next few days. So that's always in my initial education when I'm talking to the patient about threads. Some of those little barbs can pop into place, and that's totally normal, but I do try to pop as many as I can prior to them leaving the office. Here we are going in on our jawline. Again, I'm just going in with some lidocaine with epi right at our insertion point there, just making sure she's numb. And I like to pinch up that tissue as I go in just to make sure we slide right into that correct plane. And then I tent up a little bit and I like to make sure that I like where we are. And again, we're just going to go ahead and grab that cannula and do some of our local anesthesia with that 2% lidocaine. Again, I like to pinch up my tissue and my cannula should pop right into that plane. And I advance forward all the way past that area of animation. So past that marionette line, and then I give a nice push of lidocaine. You don't want to have too much fluid in those tracks. It can kind of work against what you're trying to do, and those barbs won't be able to engage as well. So about 0.5 or less of lidocaine per track. There, I went ahead and popped on my 3cc, so that's a great example of what I was talking about before. So if you ever don't like your plane that you're in, you can go ahead and pull back a little bit and change that. I cut the end of my thread, and again, I'm just going to alcohol over that entry point. And I tell the patient to leave those band-aids on for the rest of the day. And then in the evening, when they wash their face, they don't have to put them back on. But I want those sites to stay as clean as possible.